Hi, my name is Tim Martin, and today I'm going to be delivering just a short in-service called Proton Pump Inhibitors, a teaching plan, and this is for an in-service for existing experienced emergency room nurses in order to refresh their knowledge on one of the most given drugs in the ED, which is Protonix. And so we're going to talk about Protonix and the other proton pump inhibitors at the same time. So at the end of this in-service, we've got 3 learning objectives. Number 1 would be that they're going to be able to relate the mechanism of action of PPIs relative to ulcers and to GERD. And number 2 is that they'll be able to provide discharge teaching to new recipients of PPI prescriptions by stating at least 3 important points to be taught. And that would also include education that we're going to deliver as we're giving the medicines IV or by mouth in the emergency room as treatments. And then the third learning objective would be that they're going to be able to state at least 3 adverse effects that are possible from taking PPIs. So we've got the pathophysiology of GERD is one of the 2 big things that we kind of give PPIs for in the emergency room. So GERD stands for gastroesophageal reflux disease, and it's caused by gastric juices backing up into the esophagus. It can be due to a number of causes. You've got excessive alcohol intake, obesity, delayed gastric emptying, and increased gastric volume. And then also hiatal hernias can cause that kind of backup. And the serious ramifications of GERD are that they can cause dysphagia, heartburn, and then lead ultimately to ulcers and even Barrett's esophagus. So proton pump inhibitors, what are they? They're a family of drugs which are used to treat GERD and then the subsequent ulcers that come from having GERD untreated for too long or other things that go wrong in the stomach. The family includes the following drugs: esomeprazole or Nexium, lansoprazole or Prevacid, omeprazole or Prilosec, and then pantoprazole or Protonix, which is really just a stronger prescription-only form of the first 3, which are all available over the counter. And there are 2 other proton pump inhibitors that are fairly more recent, dexlansoprazole or Dexilant and rabeprazole or Asifex, and both of those are prescription only as well. We've got a dosing chart that we would share with the nurses as they're learning this. Generally, you're going to start with somewhere between 20 and 40 milligrams of these medications daily. Because there are so many potential side effects, which we'll talk about in a little bit, the recommendation is to start with just once daily doses, but especially the over-the-counter ones and Protonix can be taken twice daily as needed. They're all available by mouth, and then lansoprazole, esomeprazole, and pantoprazole are all available in IV format. They are not necessarily more effective when given IV. And really, we only do that when patients are in NPO situations because the cost of the IV formulations is so much more than the PO prescriptions. So how do these drugs work? Proton pump inhibitors are drugs which bind to the hydrogen, potassium, ATPase enzyme system. And that's part of the digestive system. And they work by suppressing the secretion of hydrogen ions into the stomach, which then stops the secretion of gastric acid by as much as 90%. So when you reduce all of that acid, you make the stomach contents, the stomach fluid more basic. You stop the irritation that might be causing the GERD in the first place or irritating an ulcer, causing an ulcer. So it reduces gastric volume and acidity both, and then thereby reduces the reflux and the irritation, and it allows ulcers to heal more easily. This little bit of information that I just gave you about the mechanism of action of PPIs is essentially the information that's needed to meet learning objective 1 as we roll through these. I'll try to address that. So they do have a number of adverse effects and interactions. They are linked to bacterial gastroenteritis and possible increased risk for pneumonia. Now, in a large Dutch study, a group of researchers showed that the information bias regarding PPIs and bacterial gastroenteritis inflated the relationship between them over 3 times more than it actually exists. There is a relationship, but it's much less than a lot of doctors previously believed. Other things that can go wrong from these medications. You've got an increased risk of fractures with extended use, uh, low vitamin B12 and calcium carbonate levels due to low acidity, and one way to fix this is by supplementing the diet with calcium citrate, because citrate is not affected by the pH of the gastric fluids. And then omeprazole and esomeprazole may decrease the effectiveness of Plavix, so it's not recommended to be taken alongside of that medication. And then more commonly, nausea, diarrhea, and headache are possible side effects. And this is the information that nurses would need in order to be able to meet objective number 2, where they're providing discharge teaching about the possible adverse effects. Actually, objective number 3, pardon me. And then, so discharge teaching, as we're sending patients out with this medication to take for prolonged symptoms. Many times when people come in with this nebulous abdominal pain and they're having reflux, and we do the full workup and we don't find anything on them, the doctor will write for a 30-day supply of one of these medications. If they've tried the over-the-counter ones, then sometimes they'll go ahead and send them home with Protonix, the more potent version. Other times they'll just send them home with one of the 3 that are available over the counter to start trying to see if they can't reduce the overall discomfort that's causing their reflux. And so we have to provide discharge teaching for these medications, just in case the pharmacy's not going to deliver it the way that it needs to be done. It's part of our role. And so things that we should tell them, and this is to meet learning objective number 2. PPIs ought to be taken 30 to 60 minutes before breakfast or the largest meal of the day. Most people take it in the mornings before they eat breakfast, but if they know they're not a breakfast eater, they can always take it before lunch or dinner. If you're going to take a second dose because your trial of taking only 1 dose a day is not working out and you feel like adding another dose might be the answer, that second dose should be taken 10 to 12 hours after the first and also before food. You should not crush the tablets because they have extended release coating. The way that these medicines work is they get through the stomach and into the small intestine, and then the coating by that time has eroded and it's able to be more effective, whereas it might dissolve and not really be able to activate its mechanism of action if it's dissolved in the stomach. Due to that, they have delayed release coating on them, and you should not crush these tablets. Even if you have a hard time swallowing them, there are capsules available, and I think there are liquid formulations available for a couple of them, because otherwise you'll defeat the purpose of that coating. If you're taking nonsteroidal anti-inflammatories, which can certainly cause ulcers and stomach upset, they should be discontinued if you're taking the PPIs, especially if you're taking them for an ulcer. And then you should also discontinue taking these medications and call your doctor if diarrhea persists for more than 3 days after beginning one of these proton pump inhibitors. We've got 3 review questions that will basically be the proof of whether or not the learners were able to meet the learning objectives. The first is related to learning objective number 1. It's true or false. PPIs function by inhibiting the proton pump, which increases the amount of stomach acid available for digestion and thereby aids in reducing symptoms. And the actual answer to that is false, because they don't increase the amount of stomach acid. They decrease the secretion of gastric acid to reduce the symptoms. Review question number 2 is a multiple choice question. It relates to learning objective number 2. The nurse is giving discharge teaching to a patient receiving a prescription for Protonix for their NSAID-induced ulcers, and which of the following answers shows that the patient needs re-education? In the interest of time, rather than reading all 4 answers, I'll just tell you the correct answer is the one that says, I can continue taking my aspirin and other NSAIDs because this medication will counteract their negative effects. And that's not the case. It's going to help reduce the effects that the NSAIDs may have caused, but it's not going to allow you to keep on taking them, the things that are causing your ulcers. And then the third review question relates to learning objective number 3. Which of the following is not an adverse effect of PPIs? We've got black or tarry stools, an increased risk for fractures, calcium deficiencies, and nausea. And so the correct answer there is A, black or tarry stools are not a direct side effect of taking PPIs. That's actually the sign of a lower GI bleed, which certainly needs to be investigated. And if you've had diarrhea for a long time while taking PPIs and it turns to black and tarry stool, you probably need to see a physician and stop taking them. But it's not related to the PPI specifically. So that should cover all 3 learning objectives with review questions and plenty of content. Thanks for listening, and have a good day.